Hello, everyone. Thank you for joining today's session titled Putting Advocacy into Action. My name is Heather Patrick, and I'm the President and CEO of Prevent Blindness Texas. I am a white female with red hair, brown eyes. I have a yellow shirt with a blue jacket on. I will be your moderator for today's discussion. Today, we will discuss how patients can drive advocacy efforts at the government, corporate, and community levels to create meaningful change in eye health and vision care. And now I would like to introduce our panelists for this session. Linda MacLeod is a retired attorney and a Prevent Blindness Aspect Patient Engagement Program graduate. Dr. Abubakar Sadik Mohammed is a vision science graduate trainee at the School of Optometry at the University of Alabama at Birmingham and a Prevent Blindness Aspect Patient Engagement Program graduate. Dr. Leslie Nwankwo is the Director of Education Services at CareBasics, LLC, and a Prevent Blindness Aspect Patient Engagement Program graduate. Thank you so much to all of you for being here. To start off this session, I would like to ask each panelist to introduce and share a little about themselves. And I'm going to start with Leslie.
Everyone, greetings from the great state of Texas. Again, my name is Leslie. I am 56 years young with a cinnamon brown complexion and shoulder-length curls the color of midnight. My eyes are dark brown, reflecting warmth and sincerity, and I believe in connecting beyond what is visible through voice, storytelling, and presence. And I thank my Lord Jesus for this wonderful opportunity to be connecting with this global audience today via this amazing platform hosted by Prevent Blindness. Just a little bit about me. I'm a doctor of nursing practice and a registered nurse of 29 years. I'm an adjunct professor at the graduate nursing program at the University of St. Thomas in Houston, Texas. And I currently serve as the Director of Education at CareBasics, LLC. I am also a very proud graduate of the Prevent Blindness Aspects Patient Engagement Program. My journey as an advocate began initially through my role as a professional nurse, but later it went on to a whole new level as I came into advocacy for myself as a patient. I have lived with retinitis pigmentosa all of my life, and RP is an inherited retinal disease that affects 1 in 4,000 people globally. RP starts by destroying one's peripheral vision, later encroaching on their central vision, creating a narrow tunnel of vision that ultimately closes off. Recently, I had the opportunity of advocating for a pharmaceutical treatment for persons with retinitis pigmentosa, currently under FDA consideration. I shared my lived experience and clinical insights to help the FDA understand patient priorities and the real-world impact of this potential treatment. My goal is to ensure that the patient's voice is central to any innovation in eye care, how it's developed, reviewed, and delivered. Thank you.
Thank you, Leslie. Linda.
My name is Linda MacLeod. I am a retired attorney. I practiced law in San Jose, California, in civil litigation for 30 years until I retired approximately 8.5 years ago, almost 9 years ago. I have Usher syndrome, which is a combination of RP, which was so eloquently described before me, as well as hearing loss. And I have Usher's type 2A, which means that I was diagnosed with a moderate to severe hearing loss at age 4. That hearing loss has stayed stable throughout my life, and I've worn hearing aids. I was not diagnosed with RP and Usher's until I was almost 30. Now I am 61. I am a white woman with blue eyes and now gray hair, nice and long and straight. And My advocacy, although I've been an advocate pretty much all of my life, once I retired, I became an advocate in the political arena. And now that my sight is almost completely gone, I have adjusted my advocacy to focus more on blindness and deafness. Thank you.
Thank you, Linda. And Sadik.
Thank you for having me. It's an honor to be part of this conversation this afternoon. Hello, everyone. My name is Abubakar Sadik Mohammed. For my audio description, I am an African male, fair in complexion, with a short dark hair, a white long sleeve shirt with a red tie. I'm a trained optometrist from Ghana, West Africa, and currently a graduate research assistant at the School of Optometry here at the University of Alabama at Birmingham. In simple language, my research basically seeks to explore how neurons communicate, how neurons in the retina basically communicate via specialized junctions called synapses, and how disruptions at these synapses is implicated in retinal degeneration, which is seen in conditions such as glaucoma and retinitis pigmentosa. Now, we believe that understanding the mechanisms of synaptic disruptions basically would help us be able to design therapies that would eventually help to protect retinal neurons going forward. My journey into patient advocacy started a few years ago when I graduated from optometry school back in Ghana, where I served in an underserved community where basically access to eye care was considered a luxury. And individuals who had routine eye examinations or who could afford routine eye examinations or even buy a pair of glasses to correct their refractive errors were considered to be privileged. So I came up with teamed up with a group of colleagues of mine and individuals from different backgrounds to basically design systems where we could make eye care accessible and equitable as well as affordable to individuals in very marginalized communities. So that was where my advocacy journey basically started. And I am of the strong opinion that no school-going child should be deprived of education just because of an uncorrected refractive error. And basically no adult should, be deprived of their visual independence just because of a condition like cataract that could, basically be corrected by surgery. So yes, I'm happy to be here this afternoon to share my perspectives on the topic, putting advocacy into action, where I'm looking at how clinicians basically or healthcare providers and vision science researchers could get on board onto, helping to preserve the vision of the many Americans and everyone across the globe who is undergoing one form of vision impairment or the other. Thank you.
Thank you, Sadik. All right, Linda, we're going to start with you. Could you share how you have advocated for yourself along with the visually impaired and blind community?
Yes, I'd be happy to do that. So as I said earlier, I've been an advocate all my life. And then approximately 8 to 9 years ago, when I retired, I shifted my advocacy to the political arena. But it's only been in the last year or two that I've focused more directly on the blindness and deafness communities. So recently, my advocacy, frankly, pretty much started out with a direct discriminatory behavior, which motivated me to then turn to the Prevent Blindness Aspect program for training in advocacy. And after that, only in the last 4 or 5 months, I have done the following. First, I joined the American Council of the Blind, and I joined their leadership conference, which is a conference that is held in Washington, D.C., and it facilitates the visits of blind individuals to representatives and senators' offices on the Hill. And we advocated for 3 initiatives. The first initiative had to do with accessible medical devices, such as insulin pumps, blood pressure machines, CPAP machines, and heart monitors. There's a bill that we are advocating for that. The second bill that we were advocating for was accessible websites. And the third had to do with accessible streaming services. So I did that. After that, I joined the NFB, which is the National Federation of the Blind, and I decided to educate myself by attending a legal symposium on disability law in Baltimore, Maryland, that the NFB was hosting. That was a 2 to 3 day symposium where I educated myself on disability law. And then the last thing I did this year was I completed a process of pursuing a complaint against Uber Technologies that I had filed a few months earlier. And in February, I went to trial against Uber Technologies and won over $12,000 for rideshare denials, 3 in a row within the space of 30 minutes. On the basis of me having a guide dog. In other words, I had drivers who refused to take me where I needed to go due to my guide dog Gideon. So those are my most recent activities, and everything, as you will learn from Leslie and Sadik, is a process. And of course, I completely expect to continue these initiatives and advocacy actions.
Thank you, Linda. Leslie, can you share how you have advocated for a pharmaceutical company for a treatment currently under FDA consideration?
Of course, Heather. I was formally introduced to a company out of Dallas, Texas, through Prevent Blindness, and this company invited me twice to accompany their team to 2 FDA meetings in Washington, D.C., where they were seeking approval for a biologic gene therapy for the treatment of retinitis pigmentosa. Their intent was to have me share my lived experience as a person living with RP in the hopes of bringing real-world context as well as a face to their discussion surrounding the approval of the proposed treatment modality. In telling my RP story at the onset of each meeting, I was able to give the audience a genuine perspective of what it means to live with RP and the impact that RP has had on my life, both personally and professionally. I was also able to communicate a sense of urgency needed for the approval of such treatments for people like me living with RP, so that we may have a fighting chance in terms of slowing or halting the progression of RP. I also wanted the FDA to understand that for many suffering with RP, the approval of a viable treatment option could serve to potentially alleviate the threat of being sentenced to a life of total darkness. After each meeting, Heather, I can't tell you how many members of the FDA team approached me one-on-one to personally express their gratitude to me for sharing my compelling story and shedding much needed light on one's lived experience with RP. As you know, the process for approval of a treatment modality through the FDA is a long and tedious one. So the company is still in the application phase, and thankfully their application continues to move along in the approval process.
Thank you, Leslie, and thank you for your work in that arena. Sadik, can you share how you have worked with the Vision and Eye Health community to advocate for federal funding in Washington, D.C. as an eye care provider?
Thank you very much, Shira. So last year, sometime in April, I was in Washington, D.C. through the Catalyzing Advocacy and Science and Engineering workshop held by the American Association for the Advancement of Science, AAAS. It was a great exposure where we learned about the federal policymaking processes. Basically, it was more like a 4-day workshop where we were taught how Congress basically works, the systems that, influences policies that are taken. And on the last day of the workshop, we had the opportunity to go on Capitol Hill to talk to elected officials, basically to share our research with them and advocate for funding for the NIH, for continued funding for the NIH. And also I had the opportunity to make a case for vision research, which is of great importance to me. Now, basically, as we speak today, over 90 million Americans, right, who are age 40 and above are living with some form of vision impairment. And these numbers basically underscore the agency of sustained federal investment in eye care and vision research. Now, through the Aspect Patient Engagement Program, which is led by Julie and her team, Liz and Janera, thanks to them for this wonderful initiative, I had the opportunity to contribute to discussions which surrounds the ongoing proposition to basically restructure the NIH and, most importantly, consolidate the National Eye Institute into a broader institute on neuroscience and brain research. Now, that is worrying. We wouldn't want the mother institution, biomedical institution, which is NIH, to, one, be restructured, and two, the National Eye Institute, since its establishment in 1968, has contributed greatly, has played a vital role basically in shaping the direction of eye care delivery in America and across the globe, and also supporting vision research. So we believe that basically this reconsolidation is going to neutralize the funding that goes to vision research, and that would affect the quality of eye care delivery to the many Americans that are basically living with one form of vision impairment or the other, and also going to stifle vision research, basically, because so much progress has been made over the years. Great scientists are putting in a lot of effort in trying to find cure for conditions such as glaucoma or retinitis pigmentosa or age-related macular degeneration, which we have family members who are living with these conditions. So it is worrying to hear some of these propositions. And, I would like to use this opportunity to call on everyone here today who is witnessing this to, try and add their voice to, in a way, oppose this proposition so we can, help maintain the independence of the National Eye Institute, just so we could safeguard the vision of millions of Americans. So that was through the Aspect Patient Engagement Program. And at the local level here at UAB, we basically came up with an initiative, which is the Science Policy Advocacy Network. And it is because we've noticed that over the years, a lot of graduate students and postdoctoral researchers have a lot of expertise when it comes to science, which is amazing, which is great. But we noticed that when it comes to things like science communication, there's little training as far as that is concerned. So I would want to mention thanks to Research America, which provided us with, awarded us a civic engagement micro grant just recently to be able to run the activities of the student organization, just so we could help to advance science policy literacy among graduate student and postdoctoral researchers. And thanks to all the team here at UAB for helping to push through this. This is what we're doing at the local level just to get students engaged, basically researchers, graduate students and postdoctoral students as well, and undergraduates get engaged in the whole concept of science policy, get them to know how best can we share our science to lay people, because scientists, when scientists meet and they are talking, it's usually very huge terminologies, and policymakers do not care about huge, all those terminologies. You need to find a way to break down your science into simpler terms so everyone can understand and be able to make meaning. Tell us the significance of what you're doing. How does that impact my life? So that's what we're doing, just to help, build that to basically equip graduate students and researchers going forward to be able to contribute to some of these national discussions. Yeah, thank you.
Thank you. Thank you for using your voice.
Thank you.
This question is for all the panelists. How can patients or healthcare providers effectively share their experiences to influence policy and the decision-making process? And Leslie, we'll start with you.
Heather, I believe patients and providers can effectively influence policy by sharing personal narratives supported by data. These data sources can include a person's historical account of living with a particular disease, the health provider's medical records, or the results from a researcher's clinical trial. Storytelling bridges the emotional and practical gaps in understanding a certain phenomenon. For example, the opportunity I had to share my story before a regulatory agency, where I went to speak authentically about my lived experience as someone living with RP, and hopefully get that audience to relate to that story. I intended for my story to offer additional context in a way that creates actionable policies and treatment modalities for persons with RP. I've also advocated before legislature on Capitol Hill for policies that keep the blind and visually impaired in mind, especially when it comes to the manufacturing of goods and services, to ensure that these goods are accessible to the BVI community. I also advocated to our lawmakers for increased funding dedicated for vision research. Thank you.
Thank you. Sadik?
Thank you, Ms. Leslie, for highlighting the importance of utilizing personal stories and experiences, which I really find that to be very intriguing. I learned through the patient, the Aspect Patient Engagement Program. It's a wonderful program that I always keep talking about. It's changed my perspective as a clinician and a vision science researcher currently on how we perceive patients or how we can get engaged. So basically, as eye care providers or clinicians would usually focus so much on finding clinical solutions to patient conditions, which is great. Thank you all for your great work in helping to find, first of all, even having to be able to diagnose a condition that a patient walks into the clinic with, and going ahead to help the patient through medication, surgery, and all of that. Now, what if we can we can move a step further ahead, just so we can truly connect with patients as individuals and not basically as cases? Because most of us, that's one thing that that's one of the things we do. And if we try as much as we can to be able to connect with patients and understand their lives beyond the walls of the clinic, I think it would really help much. And one of the ways we can do that is by utilizing patient stories, where we can invite patients to town hall meetings just to share their experiences with legislators at the local level, or even with healthcare providers or with hospital administrators. That's one other way that we can do that. And also, we can leverage on some advocacy toolkits that is provided by Prevent Blindness, for instance, has a great advocacy toolkit that clinicians can use, vision science researchers can use, and patients can also use that to also advocate for themselves. So, and most importantly, one other thing I would like to say is clinicians, there are a lot of NGOs, organizations out there that are deeply rooted in advocacy efforts. And what you need to do, whatever profession that you find yourself, try as much as possible to look for the policy arm of any of these organizations. So if you're an optometrist, the American Academy of Optometry, for instance, has a policy arm. If you're an ophthalmologist or a vision science researcher, ARVO, for instance, has a policy arm, a science communication, arm. There are other sister organizations in the country, such as Research America, the American Association for the Advancement of Science as well, and then we have the National Science Policy Network, for instance. These are great, and Prevent Blindness as well. These are great institutions that have a lot of tools or resources that can help one equip you with the needed skills that you would need to be able to go out there and advocate for yourself, and also share the stories of your patients. Yeah, so I think these ways would basically help to move move our stories out there to policymakers. Yeah.
Thank you, Sadik. And Linda.
Wow, I can't even believe I'm following these two amazing presenters, and their suggestions are absolutely fabulous. And I've actually used these techniques every day. I think what I want to focus on is a more granular, personal level of advocacy that I find can be very successful. And that is sharing your personal stories in your own life, in your everyday interactions with the people around you. What I mean by that is sharing your experiences as a blind person or a deaf person, hard of hearing person, your challenges, your successes to your neighbors, to your best friend, to your contractor, to your housekeeper, to your kids, to your book club, to your prayer group, anyone and everyone. And I don't mean complaining to them. I mean just discussing what your life and your experiences are like. And what this does is educate those around you and expand your sphere of influence. And it also expands their sphere of influence. They become interested, they become aware of issues, and then they turn around and think, wow, maybe I can help do something. People are looking to you for leadership, to find out how they can help. So some examples that I can give you recently is, example would be that recently there has been some discussion about some cuts to federal library funding around the country. And I was able to educate people on how I rely on Braille books and Braille readers and magnifiers and typewriters. And I show people the materials and I educate them for that. And they look at these items and this equipment and they think, this is really great that Linda and other blind individuals can get books for free through the mail, that children can become literate in Braille based on funding that is provided by the government. And then they turn around and they say, well, I think, what can we do? How can I write a letter? Can you give me something to tell me what to say? And they can rely on the fact that they have a friend or a neighbor or a parent who has that experience. Another example is when I went to Washington, D.C., I had a neighbor who had type 1 diabetes. She was suffering from vision loss. I asked her, do you have one of those new insulin pumps? Yes. Are you having trouble utilizing it? Do you have difficulty seeing it? Yes. Can you give me your story? She said, yes, let's meet in a week. She came back with a letter with photos and explanations. I made multiple copies of that letter and I passed it around to all of the representatives that I met at Capitol Hill. Be willing not only to share your stories, but also to go to bat for any friends or other people who can provide their own personal stories and advocate for them as well.
All great advice from the panelists. This next question is for all of you as well. What obstacles did you face in your advocacy work, and what did you learn about yourself or the process? And we'll start with you, Sadik.
All right, that's a great question. Thank you very much, Hera. So one thing I would say as for regards to public hesitation or apathy as far as advocacy is concerned, and there's often a misconception that advocacy is someone else's responsibility, or that one voice can't make a difference, which I think it's not true, because every voice matters. And basically, we need to find ways to encourage colleagues, being clinicians, being vision science researchers or researchers in general, or even talking to our patients to share their stories, to engage, even in small ways, like picking up phone and calling your elected official and saying, hey, hello, this issue is of great importance to me. I think do A, B, C, D, or even talking about the National Eye Institute currently, which with the whole consolidation thing, pick a phone, call your representative, tell them, hey, I have glaucoma and I've been diagnosed with glaucoma for this number of years. These are some of the challenges that I've been going through. And I think if we think that, researchers are still working behind the clock to find a cure for glaucoma, so we think you should oppose this, proposition, because if not, it's going to. So when you use some of these stories, or even write a letter to your representative, all of these efforts help, because you might never know when the representative is going to pick your story and then when it's going to touch them, because using personal stories usually help. And we think that's one challenge I've faced with advocacy, and I think this is how we can go ahead to help resolve it. It's usually based about building the relationships with policymakers, or even at the local level and both at the national level, and then creating awareness of what is of importance to us, and also that would slowly help to shape policies to help advance eye care and vision research. Yeah.
Thank you. Linda.
This is such a personal question, and I'm so happy to share it with you. My biggest obstacle was really myself. My obstacle was overcoming my internalized ableism and coming around to the idea that advocating for blind individuals and people with hearing loss is a worthy cause. It is something that is worth fighting for. And when I first retired 8.5, almost 9 years ago, many people, and I was struggling with trying to decide whether to retire. Many people said, well, why don't you just become a disability lawyer? And at that time, I actually was angry and insulted by the suggestion, because it assumed that just because I was blind, I would want to become a disability lawyer. And it also negated the fact that I actually practiced law very well in civil litigation, not in disability law. But about a half a decade later now, I am fully engaged in the advocacy work that I've chosen because of my blindness and my deafness. It has given me inspiration from the people around me, and it motivates me to fight hard for those who don't have the skills that I may have in advocacy to be able to go to bat for them and myself. The lived experience that I have keeps me going. Although it is such, it can be very emotionally draining, at the same time, it also develops your resilience, and it gives you powerful moral authority to be able to educate people on these policies and what actually works and doesn't.
Thank you, Linda. Your perspective is so incredibly powerful. Thank you. And Leslie, we'll wrap up this question with you.
Wow, Linda, I consider you and Sadik to be quite seasoned in the realm of vision advocacy. So I really do appreciate your share. For me, one of the biggest obstacles I faced in advocacy was feeling unsure about how to start, where to go, and who to talk to, or whether or not my story would even matter. And the Aspects program was truly beneficial in helping me to alleviate my initial apprehensions. What I learned through the advocacy process is that change is slow and often layered, especially in government settings. I learned, though, however, through my advocacy experiences, that I have a resilience and power that I didn't know I had as a storyteller. I also learned to be persistent and understand that persistence, partnership, and preparation are all keys to being successful in advocacy. I also learned that advocacy is not a solo act. It's truly a community effort. Thank you.
Thank you, Leslie. Okay, this next question is for Linda and Sadik. What strategies can patients employ to engage with policymakers and advocate for improved eye health policies? Linda, we'll start with you.
Thank you. You know, Leslie and Sadik are so fully engaged in the healthcare industry, and they're going to have some great strategies. My strategy is going to be very granular. My advice is going to be very granular because oftentimes people do, as Leslie say, have a hard time figuring out where to start. And basically my answer to this question focuses on developing your Rolodex and putting all of those contacts into your smart device. And so what I mean by that is start by pulling together all of the contact information of your local, federal, and state governments. That means your mayor, your city council person, your librarian, the Department of Transportation of your local area. There's so many other areas, your board of supervisors, and then go on to the state assembly and your government and your governor and the attorney general, and then start putting in the phone numbers of your congressional representative, your senator, and any other departments that you find that you may need in the future. It's so important to do this before you are going to need it, because when you need it, you're going to be stressed, you're going to be under pressure, you're going to be upset emotionally if something involves you directly. And so if you can have all of that contact information already in your device, you're way ahead of the game. I don't mean just the government, though. I also mean customer service representatives, the accessibility department of your airline, the accessibility department of your medical, your medical group, your doctors, customer service representatives, social media groups. Have all of that ready at your fingertips so that when you need it, it's there and you can then go with it. When I got denied my Uber rides, I already had in my phone Uber's support email. I had directions on how to do it. And I already had I think I asked a friend, which is another suggestion that I have. Ask your blind friends or those in your community for contact information that they have. And I asked a blind acquaintance or friend of mine to give me the information for the Department of Justice so that I could report the Uber denial to the Civil Rights Division. So it made things so much easier when needed, because oftentimes it becomes a very urgent situation quickly, especially now in current times.
Great. Thank you, Linda. And Sadik.
Thank you, Ms. Linda, for highlighting the importance of networking or building connections as far as advocacy is concerned, and that is very important. Basically, imagine if you had a friend who is, let's say, in Congress, and there's a policy that is being, a proposition that is being passed, and you can just pick a phone and call him and say, hey, I think ABCD, I would want you to, oppose or, support this bill, or basically that goes, who basically helps. So I think that is very key, that anyone who wants to get started in the policy advocacy space should try to go out there and build connections. And one of the other things that I can think of as far as a strategy that patients could employ is by using everyday spaces to initiate conversations, right? So advocacy doesn't only start at Capitol Hill, okay? What can you do as an eye care provider, what can you do as a vision science researcher within your own community? How do you start? One of the things we need to do is by starting small. We need to begin to share our science to local communities so they could see the relevance in what we're doing. There's this disconnect between scientists and our local communities. People basically kind of, see scientists to, we need to find a way to kind of demystify the whole concept of scientists always being in the lab and then not building networks with communities. Because trust me, we do not have the numbers to oppose certain, policies that are going to be passed by policymakers. We need the support of communities to rally behind our backs to be able to push this. So one of the things we're trying to do here at the local level is by going to places like the farmers markets and then have like a tabling event where it will be like, speak to your scientist. So yes, patients could adopt this strategy, have a tabling event at the farmers market or within the local community, and then say, talk to me about glaucoma. Ask me any question about retinitis pigmentosa. That way you get to educate your people, you get to educate people within the community about the eye condition. And two, you tell them, you share your personal experience, your lived experiences of your daily routine with that condition. How do you go about your daily activities? You would never know. People will be curious to know that because no one knows like when they're going to be hit with a condition. Nobody knows that, right? So these efforts would usually help. So start small, basically start at a grassroots level and utilize your networks and try to share your science and your conditions or basically create awareness at the local community level. So I think these would help. And also, I think we usually people should also try and then form collaborations with some of the already established institutions like NGOs such as Prevent Blindness. I keep repeating this. NEVA, for instance, AVO, and all organizations that have policy arms like Research America. Try and then form connections with these institutions, learn from them. They have very good resources that could help you, fast track your whole advocacy journey. And I think these would, help for just at the beginning level. Yeah.
Thank you, Sadik. The next question is for all the panelists. How did the Prevent Blindness Aspect program help you in your advocacy work? And Leslie, we'll start with you.
Well, I don't even know where to start with that. The Aspects program, I just can't say enough about it. The Prevent Blindness Aspects program gave me the structure, mentorship, and confidence that I needed for self-advocacy. It helped me frame my story for different audiences, whether speaking with policymakers, regulatory bodies, researchers, or even support groups. It also connected me with a network of advocates, each bringing their own powerful experience to the table. That community and hands-on training that I received through the Aspects program was tremendously invaluable in shaping my impact when it comes to sharing my story.
Great. Thank you. All right. Sadik.
All right. Thank you. The Aspect Patient Engagement Program is a wonderful initiative, and thanks to Julie and her team, Liz and Janetta, for organizing this yearly, and thanks to Dr. Ellen, who first got me introduced to the Aspect Program. The Aspect Program has really helped to change my perspective on a lot of things, coming in from a clinical background where usually we would all we care about is what symptoms are you coming with to the clinic, sit behind this instrument, let me have a look at your eye. Okay, so get a list of differentials, eventually narrow down to one condition and be like, okay, this is the condition that you have. Go to the pharmacy for your medication. That is it. But when I joined the Aspect program, we had individuals who had lived or who have lived with conditions, different conditions of the eye, and they get to tell their stories. They get to share how they live on daily basis with these conditions. So it really hit me reflecting back on the days when I was practicing, where all I cared about was, basically looking at patients just at the symptom level and diagnosing them with conditions and not pushing beyond that. So I think basically what I'm trying to say is the Aspect Patient Engagement Program has helped refine my perspective, and I would really recommend it for every clinician, any student, or any researcher who is interested in vision and advocating for patients going forward, because it would really help you understand some of the nitty-gritties of what patients go through, and that way you have more like a reason to stand on to be able to talk to policymakers and say, hey, this is what is going on. These are some of the experiences that people with glaucoma or people with retinitis pigmentosa go through, and it's you can use that as a basis, right, to support whatever policies that you want to push or advance. And yes, thank you so much for this wonderful initiative, Prevent Blindness. It's a great one. Yeah.
Thank you. And Linda.
The Prevent Blindness Aspect program provided me with the realization of how important personal stories are. And you're hearing a theme here, but I want to make a couple of points. One is the Aspect program actually guides you into a training of how to tell your own personal story in 5 minutes. I've been advocating and telling stories in trial and out of trial for many, many decades before the Aspect program. But having to try to tell my own story in 5 minutes in a powerful and inspirational way was quite a learning experience, and the Aspect program really guided me into doing it in I believe, a powerful way. And the reason I know this is because I got to hear everyone else's 5-minute stories, and I can tell you that every single one of them moved me, inspired me, and they were and made me realize that we are in good company with the advocates that are around us in the Prevent Blindness program. So I can't recommend it enough. And I would encourage anyone who wants to get started in advocacy or even continue the advocacy after decades of training as an attorney, I can guarantee you'll get something out of it.
Fantastic. Thank you, Linda. Okay, we've got 2 more questions for our panelists, and then we're going to go to audience Q&A. Okay, so panelists, this is for Linda and Leslie. What resources are available to patients who wish to become advocates for eye health, such as training programs or support networks? And Linda, we're just going to start with you.
And I'll make it quick, and I'll just list the resources that I have used. The Aspect program is a great resource. For me, the National Federation of the Blind and the American Council of the Blind have been fantastic resources. Both of these organizations have programs where you can go to Washington, D.C. and advocate directly to Congress for eye health initiatives. So these are wonderful organizations to sign up for and become members of, and both of them have advocacy departments.
Thank you, Linda. Leslie?
Well, in my personal opinion, the best resource on the planet is the Aspects Prevent Blindness Advocacy Patient Engagement Program. There are other resources such as Fighting Blindness, Vision Loss Alliance, and as Linda stated, the American Council for the Blind and the National Federation for the Blind, which are all organizations I've been a part of. But these are organizations that really are great places to learn more about the various topics affecting the blind and visually impaired community. And once you step into these organizations, hopefully it'll spark your interest to get more involved. Thank you.
Thank you, Leslie. Okay, this last question is for all of you, and then we'll move into audience Q&A. What guidance would you share with patients, care partners, or health professionals who are unsure about how to start their own advocacy journey? Leslie, we're going to start with you.
I would say to those who are unsure of how to start their advocacy journey to just start by taking a deep look within. You already have what you need to start, and that is your story. Start small by sharing your experiences with a friend, a healthcare provider, or support group. Connect with other organizations like Prevent Blindness, and be intentional about really connecting with others in the self-advocacy space. Keep in mind that advocacy is all about progress and not perfection. And most importantly, your voice has power. Remember that. And when shared, it can transform attitudes, policies, and most importantly, lives. Thank you.
Thank you. Sadik?
That's a great submission, Ms. Leslie. Yes. So what I would say is just have yourself educated as much as you can by utilizing some of the resources provided by, institutions like Prevent Blindness and some other sister organizations where you have advocacy toolkits that you can, basically learn from. And also, just don't wait for a good time to start because your story is unique and your voice matters. So there's really no good time for you to start as far as advocacy is concerned. Just like Ms. Leslie said, start small, talk to someone who is close to you, use spaces that are close to you, like, the farmers market or any space that, where you can tell your stories to individuals. Just utilize that. And for professionals like clinicians and vision science researchers, my advice is get connected with your professional organizations, get in touch with their advocacy wings. So just the different advocacy wings that they have or arms that they have, get engaged with those organizations and then learn from the resources that they provide just to help, develop your, policy or advocacy skills. Yeah.
Thank you, Sadik. And Linda?
Well, I don't have much to add to those terrific answers. What I would say is use your own motivation, use your own interests, and follow your passion in that regard. And, once you join an organization, you're going to start getting emails, and there's going to be opportunities for you to join webinars, to volunteer, to donate money, and just continue to follow the thread as far as it will go. And before you know it, you will have spheres of influence. You will have contact information. You will have ideas about how to get started, and you'll be able to follow your passion in that regard.
Thank you so much. Okay, so now we're going to go to audience questions. And Linda, the first question is for you. I have a coworker who has vision and hearing loss and struggles with devices like blood pressure machines and glucose monitors because the voices are often too quiet. Do you know of devices that offer different voices or are more accessible for people with hearing loss?
I don't have any specific information about blood pressure machines and devices that would assist in that regard. Unfortunately, there are no laws that require medical devices to have screen readers or to have other programs in the devices to require that. The bill that we were advocating for would be a prospective law that would require any medical device company going forward, if they wanted to get any approval from the FDA for a new device, it would have to include accessible screen reader technology. The good news is last year there was bipartisan support for the bill that was being advocated for. 100 representatives and senators on both sides of the aisle had supported it. So I pushed very hard for it, on the idea that it was very possible that perhaps if the bill was reintroduced this year, that it might actually get passed.
Great. Thank you. So thank you today to all of you for all your stories and your advice and insight.